Guam loses about $80 million a year when patients go off island for health care. That's according to Peter Skro. Skro is the president and chairman of the Guam Health Care and Development Foundation that is orchestrating Guam's new private hospital. Skro says when people leave island, it isn't just a health care issue, it's also a significant economic issue. Skro says the hospital developers, the investment banking firm, and the hospital consultants from the mainland would like to see most of that money stay within our community.
That's money that can be taxed, that's money that can help grow our economy, they feel that after looking at the areas of why people are leaving island, the specific details of approximately 315 people every month that leave Guam, the specific diagnosis and the specialties that will be available at this hospital. We're looking at trying to retain about 65 to 70% of that $80 million that's leaving Guam annually.
Skro says last week the board of directors from the medical city in Manila unanimously voted to invest $80 million into Guam's new hospital.
The total project cost for phase one, which has grown, it's not just 100 beds now, it's 130 beds, and will include also a medical arts building, which is physicians' offices, so that they can have clinics with a bridge connected to the hospital, so the doctors can be right next to the hospital. The total cost is $198 million.
Skro says $80 million will come from the medical center, and a bank has been identified to approve the remaining $118 million balance. This state-of-the-art hospital will be located at the corner of Route 1 and Route 3 near the Micronesia Mall. Skro says a lot of the equipment that it will have doesn't exist on Guam, and it will have an electric medical record system. This system will be linked with public health clinics and the Guam Memorial Hospital. The hospital will also offer new jobs.
From an economic standpoint, the hospital at a ratio of 4 employees per bed, you're looking at a good 500 new jobs that are going to be created here on Guam, and that includes medical staff.
Skro says the recruitment process for the physicians has to be a year before the design of the hospital.
As far as recruiting and retention, definitely started already dialogue with local physicians that are already licensed. Those will happen again this week, and then in January we're going to be taking a trip with the entire development team to Stanford Medical School, the University of Pittsburgh Medical School, and then also Mayo Clinic and Cleveland Clinic.
Skro also points out that part of the overall plan will also include a medical tourism component. He says the Guam Visitors Bureau has been trying to attract older Japanese and Koreans because they will spend more money on Guam.
In all the research that we have done and the data coming out of both countries is that the number one thing they look at before they go to a destination is healthcare and public safety.
Skro says the new hospital will have Korean and Japanese U.S. board-certified doctors in their rotation to help Guam's foreign visitors. Skro hopes that the grand opening will take place in January of 2014. David Macaluso, PNC News.